difference for me from doing this type of work in another couple different types of facilities, a CBRF and assisted living, they were jobs. They were truly jobs. I enjoyed the jobs, but I didn't have a say in how I felt things should be done. And if I wasted my breath to say how I thought they should be done, I could have just as well have hit my head against the wall for a while. But here, it's not a job. It's a career. You're a professional. You're treated that way. And the people that we have as clients, if they are able to realize yet in their state of mind, they treat us that way. If they're not, their guardians or their family treats us as professionals. They know that we really care and we love what we do, or we wouldn't be doing it.
I think mainly because it is a co-op. It's amazing to see how people kick in when they know it's their company and their concerns, and what they come to me with, the concerns with their clients. It's amazing. They just don't go do their job and leave it.
This is Wayne Adams, my client in Wautoma. I've helped Wayne for, what, since 1993, I think.
It's been
About
a
that
long
I've been,
time.
he's become sort of like a brother to me. The time always goes fast, very fast when I'm here. It's like, oh my gosh, I have to go.
An hour goes very fast. But it's a very important hour that she spends on Fridays, so.
And we usually talk about Survivor because we've been watching that until the
whatever
end. Did you
show
see
is-
it Thursday?
Yeah.
Oh God, that woman power. That was wonderful.
That's good, yeah.
Before I started with Cooperative Care, all I was a recipe card with my name and a couple things on it. So now I have health insurance, I've got vacation, I have a chance to join committees.
I worked for a nursing home for 7 years and did what I was told, when I was told, how I was told, and that was it. I would not speak up. I would not say anything because that was my job. I needed my job. I needed my insurance. When I came to Cooperative Care, I have a say in how the business is run. This business has given me so much, probably more than I've given it. It has changed me as a person. I do speak up now. If I have something to say, I speak up and it's heard.
If a member owner has a concern, they can write up their suggestions and present it to the board, which I have done recently. It was an issue of member owners that were working and couldn't attend the annual meeting, and to have some kind of compensation for them.
I guess I always consider myself a leader. As far as being president of clubs or church organizations or anything like that, I never had enough. Never thought I could really do that. But I just think being part of the co-op is really, I mean, it's encouraged me a lot in that avenue.
Being a member of this cooperative versus an employee somewhere else, it raises the bar for you personally. It's no longer acceptable to call in and just not go. There isn't anybody else likely that can be there. Versus working at a grocery store or where somebody else can just pick up the next register. And so we are all responsible to each other in that business sense that if somebody's not going to a client, then one of us needs to go.
Or one of the main fellowship builders, I should say, is when we go on a trip together. We went out to Iowa to their caregiver conference for 2 years in a row now. The first year we attended just as caregivers. Last year we went and presented our values-based self-evaluation. It's just fun to get together with other member owners outside of work and do something besides work.
We got to meet a lot of caregivers from Iowa. They received our presentation really well.
Is that when you went to see the Spam Museum?
Yes.
Oh, we went to see the Spam Museum. I was so impressed. But they, so well.
Mary Ann and I have spoken at a conference, at a Women in Poverty conference, and that was scary but lots of fun. You make an impression on other people that caregivers are capable people.
there weren't that many people in our session, but we weren't even done with our speaking, and they were raising their hands, asking questions constantly. So it was very well received. And then the highlight was we went the night before and with another person. It was her room, so she is very thin. She had one double bed to herself. Tracy was way bigger at that time, and I was just as big as I am now, and we shared a double bed, trying not to touch each other.
Get to know
That
your
must have
fellow
been fun.
And as soon as I got up in the morning and got out of there, Tracy went, yeah!
We just recently were at a nationwide conference in Baltimore, Maryland. You know, being a caregiver and being in a room with politicians and people who make government policy, and in a space where you can really have a voice in the change that is nationwide.
I know all the small discussion groups that Deb and I were in, or the ones I was in for sure. When I mentioned I was a member owner of Cooperative Care, what's that? How does it work? And like I said, the co-op has helped me grow as a person so much. I now have spoken at several conferences. I just am no longer that mouse in the corner.
Yay. Yeah, I think if you talk to anybody on the board, and anybody that went to New York or to any of the conferences, it's really been good for all of us. We bonded on the way and there and the way back, and we did a good job. We did a real good job.
It's very empowering to find that within yourself, that you can do it. You're not just a caregiver. Here you own part of the business, you have a say in how things are run, and you can do it. That's the best part, you can do it.
Yeah.
When I went to a conference in Milwaukee, I didn't have anything written down that I was gonna say, or I didn't know what to say, and I was nervous to wreck. As soon as they put the microphone in front of me, that's all it took. Boy, I was off and I couldn't shut up.
It's something you love and
Yeah,
something you
that's
care
true.
about. It's easy to talk. It is.
I'm not sure we all knew we had it. I'm not sure we all knew we had it. I didn't. I didn't think I could do anything like that.